Hi everyone, my name is Kaylin Turner, and today I'm going to be sharing with you my PowerPoint presentation on the topic that I chose to implement on my unit, purposeful hourly rounding. I'll go ahead and share my screen and we'll get started. So to begin the project, there were a couple of things that needed to occur before I implemented it. First, I analyzed current peer-reviewed literature on compliance with purposeful hourly rounding. This consisted of reviewing 10 peer-reviewed literature pieces and then writing an annotated bibliography on what was shared in those studies. I implemented the new purposeful hourly rounding on the Med-Surg unit for a 1-week time frame, and then I evaluated the effects of the purposeful hourly rounding on the unit by evaluating the staff's concerns and how they felt that it went. Did you know that 700,000 to 1 million patient falls occur every year? What if I told you that as nurses and healthcare staff, we could help reduce those numbers? In order to help assist with this, nurses all across the world are being taught the ways of hourly rounding or intentional rounding. This is something that has been studied for many years, and there are many studies being conducted throughout the world regarding the effects of hourly rounding on patients within the hospital settings. The main objectives of hourly rounding are increased patient safety and satisfaction, a decrease in nurse burnout, a decrease in call bell fatigue, and the building of a trusting relationship between the nurse and the patient. Throughout this presentation, I will be discussing how I implemented an hourly rounding project on the Med-Surg unit that I currently work on and how the nursing staff responded to the project. Some achievements of the project goal. As I previously stated, review of current hospital procedure and policies on hourly rounding. The hospital that I work at does not have a protocol to follow, but they do have a procedure that goes through the steps that I will discuss throughout this presentation. Another thing that we discussed on the unit with the nursing staff was what are some barriers that could prevent the nursing staff from being compliant with hourly rounding, such as patient acuity, short staff, not having enough resources, things like that. Then I created a lesson plan that would provide the nursing staff with a better understanding of the reasoning behind purposeful hourly rounding and how it can really impact your unit and your patient care. Then I implemented the project on the unit for 1 week, and I created a post-quiz and survey to analyze the overall project by the staff that were involved. Achievement of project goals. At the end of the implementation phase, nursing staff were able to verbalize and understand what hourly rounding was, implement the 4 Ps of hourly rounding, and understand the importance of the hourly rounding process. You can see on the screen to your right, you'll typically hear the 4 Ps of hourly rounding. Well, what are they? So the 4 Ps in hourly rounding consist of assessing the patient's current needs that may involve assistance with going to the bathroom, potty, adequate pain control, pain assessment, positioning, and personal belongings. These 4 patient needs have been linked to increased patient fall and injury due to the fact that each of these actions can result in the patient attempting to ambulate on their own to achieve their desired needs, such as reaching for their cell phone or other personal belongings, attempting to ambulate to the bathroom by themselves, or attempting to reposition themselves. So there were several strategies that I used when completing this project. The first was the literature review to include 10 peer-reviewed articles on purposeful hourly rounding. This kind of took a deeper look into certain ways in which these projects have been implemented, the certain staff that they used. The majority of them were nursing staff, but there's also an article that I found that included the nurse managers and how that was actually really good when it was implemented on the unit, because the nurse managers were able to assess in a better way what the needs of the patients were. A lot of times, we get patients on our floor, and it is the acuity of care that they require that makes it such a barrier in order to be compliant with this. A copy of the current process for hourly rounding obtained from Riverside Systems. Choosing nursing staff to partake in the study. I chose the night shift nursing staff. That is what I work. It was much easier to gather with them when we all work together. And it was just an easier way, including the mentor. She also worked the night shift. So I chose 7 nursing staff from the night shift group. Education materials were created and displayed where nursing staff could see them. I did post the 4 Ps around the nurses station and in the nursing staff lounge. I also made a poster that kind of went through the reasonings for the purposeful hourly rounding to help staff understand the importance of it and how it can really impact in a positive way on your unit. And then I held a short in-service for the selected nursing staff, educating them on the project and the overall goals of the project. Not necessarily that, this had to be top-notch, the best project, but, going through the steps of how to implement this into your already busy workflow and really think of ways that made it easier for the nursing staff to participate in this and also keep their patients safe and included in their workflow. As I stated, implementing the project over a 1 week's time frame and testing the nursing staff on the learning of the project objectives. During the implementation phase, I gathered the staff chosen to participate in the study prior to their shifts and encouraged them not to hesitate to come to me with any concerns or issues when practicing hourly rounding during their shift. The staff were all very engaged in the project. They were very accepting. They really enjoyed the posters and the information. The range of years of the nursing staff that I chose was very interesting because majority of them were nurses between, their first year and maybe year 10. But then I had one seasoned nurse, and he had been nursing there for 27 years. So 2 of them have been with Riverside System for quite some time, and they were able to kind of give me some feedback on previous years when this same project or process had been implemented, and certain ways that they did things when they first started it that just did not work. So that was pretty interesting to hear and kind of try and implement that into my project as well. Outcomes for the unit. So we certainly wanted to see a decrease in patient falls, a decrease in the usage of call bells, which can help eliminate call bell fatigue, increase patient satisfaction with their care, increase the nurse to patient relationship, creating a more trusting environment. This can also be true with the patient's family. A lot of times the family members will be present throughout the shift, and it allows you to really build that relationship of trust with them. And then increase patient and family involvement in plan of care and understanding of medical treatment being provided. Application of the project. 6 nurses in total participated in the project. 4 of them were registered nurses and 2 were licensed practical nurses. Educational materials and in-services were provided to staff for further understanding. And then hourly rounding was implemented over a 1-week time frame, with nursing staff rounding on their patients every 2 to 3 hours during the night shift. I also printed out a hourly rounding paper, kind of a chart for them to kind of be a reminder. They can keep it with their report sheets, as they're sitting down and charting on their patients. If they go in order, with each patient, they can write down when they rounded, what they helped the patient with, to give them an overall feeling of at the end, they can look back and say, wow, I really did do a lot with this project, or, what could I have done differently to be more effective? And of course, the value of the project, as we've mentioned, a lot of the studies will tell you the same thing when it was implemented on those particular units. Enhance patient safety and satisfaction. A lot of times the hospitals will use what's called the HCAHPS. That's a survey that the patients are given after discharge. They send it to them at home or through the email, and they fill it out, and they will send it back to the hospital. And then we are kind of graded on how well we did, what could we improve on, things like that. Decreased patient injuries related to falls. I'm sure, as most of us working in healthcare, you know that when a patient falls, there is, of course, the risk of injury to them. And then also, there's a lot of paperwork and there's a lot of money lost for the organizations and hospitals if there is an injury to that patient. So it's just very, it, it creates a much more drawn out hospital stay for a lot of patients who do have injuries related to falls. Building a trusting relationship with the patient and family, and then overall healing for patients. When the patients are comfortable, when they feel that their needs are being met, when they are building a trusting relationship with their nursing staff or even the whole medical team, I feel that it really does improve their overall healing. It lessens their chance of staying in the hospital longer. They're more involved in their care. They want to be more involved. They understand what's happening. So I really do appreciate that aspect. And there are my references for you if you'd like to take a look. And I thank you for watching. Bye.